Okay, so hello everyone. We are going to talk about our discussion portion, our strengths and limitations portion, future implications, and the conclusion, as well as some other relevant topics. Okay, so we already discussed intro, methods, and results. So the thing about discussion section is that it's basically an elaboration of your results. Why did you get those results? And what do what does previous literature say about it? Like what does previous literature have which is in accordance to your results, or it is contradictory to your results? So that's what your discussion portion is. All right. So I'm going to show a sample discussion to you guys. All right. So basically, it's the toughest part to write, and it's also extremely important. Why? Because your results matter, obviously, what results you're getting, they matter a lot, but they don't really make that big of a difference if you don't explain them properly. If I get the result that um, the incidence of adverse events is significantly superior for the intervention group. That means that the intervention group has lesser adverse events. Now, that's a significant finding, but if I can't explain that properly, like by explain, I mean if I can tell them what does previous literature say about this? Does previous literature with the same PICO have the same results or not? And the other thing is, what I should explain is that why does the intervention group have more have lesser incidents of adverse events? Now that's the thing that you have to discuss for each and every outcome of yours in the discussion section. Okay, so how should you start with the discussion? Basically, when I write the discussion, I prefer to start with, a general intro of our topic. Like, don't dive into it straight away. I'm not written this one, this has been written by someone else. So let me show you guys one that I've written to explain what I mean. Okay, so here, as you can see, is that at first I explained the topic a bit. Like conventional vein harvesting is the making of a long continuous skin incision along the lower leg for the purpose of exposing and harvesting the great saphenous vein and grafting it to bypass blocked coronary arteries. Corn technique is an acceptable treatment option, but comes with extensive wound complications. Thus, a novel no-touch technique has been introduced with a lesser risk of complications and has been hypothesized to have greater patency. Now, you might be wondering that we have already mentioned these things in the intro because introduction is a detailed, explanation of what your topic is. So why should we repeat that in the discussion, in the start of discussion? Well, the reason for that is that it creates a proper, a background for it, for the discussion portion specifically. So that you don't directly start with our meta-analysis, assess these two groups, and these were the results. Because that does seem just a bit odd. But if you do start that way, it's totally up to you. It does make a small difference, but in the end, it's your choice. I'm telling you guys the better option. The better option is to start with a bit of an intro to your topic so that the discussion is easy to read and understand. All right. Then we mention our results in a very summarized form. How? See, like you have all of these outcomes separately, right? That this was significantly superior, and this was also significantly superior. This one was also significantly superior. This one was not superior, significant. This one was also not significant, neither this. So how do we write this? We write this meta-analysis compares the mention your intervention versus mention the control group in mention your population in terms of when you write in terms of here you write the names of your outcomes. All right. In terms of patient outcomes, which are primarily graft failure incidence, graft occlusion incidence, and leg infection. Now, why did I write primarily here? Because these are our primary outcomes. These three are the primary outcomes, so I wrote primarily these characteristics, these outcomes. In addition to these, now we are talking about our secondary outcomes, revascularization, all-cause death, and myocardial infarction were secondary outcomes considered by this study. So see, what did we do up till now? We wrote about the we wrote about the topic, an intro to the topic, what it is, why, it does have a few complications. That's why a new technique has been introduced, and then we write up about our own meta-analysis. What's the topic of our meta-analysis and what does it assess? So then we write about the outcomes. All right. Both techniques were found to be comparable in terms of revascularization, all-cause death, and myocardial infarction. Now, in this portion, we give a brief summary of our findings. How in 1 or 2 lines. However, a lower incidence of graft failure and graft occlusion was reported in the NT group with a higher risk of leg infection. All right, so that's your first paragraph. What did we do in the first paragraph? A brief introduction to your topic. Then what your meta-analysis is about, what outcomes are you considering, primary and secondary, or if you are dividing them on the basis of other classifications like GI outcomes and respiratory outcomes, that's totally up to you. But we have normally only primary and secondary outcomes. So primary and secondary outcomes it is. Then in a line or two, we give a brief summary of our results. Which results were significantly superior in which group, which results were comparable, in which results was the control group superior. We write about all of that. That's the first paragraph of the discussion. It's a general paragraph, a very general paragraph. It does not dive into the specifics of any outcome. Okay, so once we're done with the first paragraph, we go towards the second paragraph, or from where the main thing starts. Now, what's the main thing? What I mean by the main thing is that we go for the primary outcomes first. So you take one primary outcome, and you explain that just the way I said it. But we'll go into the details of that as well. Now, in case your meta-analysis is an updated meta-analysis. A meta has already been conducted on it. You found some new studies. You took those new studies and the previous studies and you did a meta-analysis again. Now, in this scenario, we will have an extra paragraph before we start with the outcomes. And what will this extra paragraph be about? It will be a comparison of your meta-analysis with the previous one. See, let's have a look at this one since this was an updated one. So we have done that. Previous meta-analysis have explored this topic. The meta-analysis by name of the author et al. Reports a decreased risk of graft failure and occlusion in the NT group with insignificant results in terms of major adverse cerebrovascular and cardiovascular events, non-fatal myocardial infarction, repeat revascularization, and all-cause death. See, we mentioned the results of the previous meta-analysis in this line. Then again, leg infection incidence was reduced in the Con group. Now, what's the con group? It's the control group. Conventional vein harvesting techniques, that is. And here we give a reference for the previous meta-analysis. Okay, these findings are in line with our primary and secondary findings. Mustafa et al. In their meta-analysis revealed a significantly lower graft occlusion incidence in the NT group, accompanied by an increased limb complication incidence. The findings of previous meta-analysis conducted on this topic are in line with our results, indicating that the evidence existing regarding these techniques is certain. Now, in this scenario, the results of the previous meta-analysis are completely similar to the results of our meta-analysis. That's why we have written that, oh, these findings are in line with our findings and all. But let's consider a scenario where they aren't. Let's say that the previous meta-analysis has different results than yours. Now, what does that suggest? That suggests that the newer studies which you included, which were not there in the previous meta-analysis, had some results which were quite different than the results of the previous study. All right? That means that they discovered something new. Their results were different. So then what will you do? In that scenario, you will discuss the possible causes of that. Why is that? Why are we getting different results? First of all, you will mention that their results are dissimilar to ours. But after that, in the same paragraph, you will shed light on the causes of it. Why is it happening? Why are their results not the same as ours? Okay. So, and how will you find that? Well, my go-to technique is obviously Google search. Okay. Like, let's just say, wait a second. Simply type, why does the tip, you will get this AI overview, which is basically, a summarized form of many articles, and those articles are linked here. See, click this link sign, and you will get these. Now, let me show you guys something cool. The meta analysis I am showing you guys was published 4 days ago. See, it's this one. And it has already been, mentioned over here. That's really cool. Okay. See the other reference from 16th August 2024. Now, this is the previous meta-analysis which we have mentioned. See? So, what my point is that if you just search it over here, you'll get this AI overview, and from here you can get so many references which will have your possible, your outcomes of interest and everything that you want to discuss and discover. Okay, so back to the manuscript. All right, so let's start with how we discuss the outcomes. Let's see, our first outcome was graft failure and graft occlusion. These were our primary outcomes, right? So I mentioned both of these together. Why? Because they are related to each other. These two outcomes are related to each other. So I have discussed them together. How NT was associated with a reduced incidence of graft failure and graft occlusion per patient. Graft failure occurs due to multiple reasons which are attributed to characteristics of the targeted vessels, biological mechanisms, type of graft, but most importantly to surgical technique. Now, what have I done? First of all, I have mentioned reasons for graft failure. Why does graft failure occur? Then I have referenced a previous meta-analysis. What were the results of a previous meta-analysis? And then I have given a reference for another study saying that the intervention group was superior to the control group in terms of graft occlusion rates at 8.5 years. And the reference for it, one of the main causes of graft patency is the presence of nitric oxide synthase in the endothelium, which has been found to be preserved in the NT technique, resulting in increased patency of the graft. See, now why have I mentioned this? Because it's important. How do you go about this? When you are explaining an outcome, first you will mention your results, what your study showed. What did your study show? That the intervention was associated with a reduced incidence of XYZ outcome. Then you mention what could be the possible causes of that outcome being significantly superior in one group and not in the other group. What are the causes of the development of that specific outcome? Now, here it's graft failure. So, what are the causes of it? Then, if there has been any previous meta analysis um, mentioning this specific outcome, you reference that as well. Now, you might already be wondering that we already discussed the previous meta analysis over here. So, why are you mentioning it again? Now, the thing is that if you have already mentioned it, but you just mentioned that which outcome is superior in the previous meta-analysis and which is not. Here we went into the detail of it. See, 76%. We also mentioned the p-value as well, 90% patency rate. So it's a more in-depth analysis of one specific outcome in light of the results of the previous meta-analysis. That's why it's important to mention it here as well. All right. Then for the other one, let's see, what do we do after this? Then we give references, how as many references as you can find, but keep it limited to maximum 4 or 5, not more than that, and explain it in a proper flow. Not Do not make it sound like you are just throwing around references and pasting them here and it doesn't make any sense and all the text is irrelevant to each other. No, relate it to each other, write it properly. And here you can even use AI, like take help from it, ask it to give it a proper form, but do not copy paste that. Don't make that mistake because that will show up as 100% AI generated text and you will be doomed if someone finds that out. It decreases your credibility as a researcher because that is against the ethics of research. You should write it yourself. You can take help from AI. I'm not saying that you shouldn't. Everybody does it. But do not use 100% AI generated text. Take your own words. You guys are all very competent human beings, very competent researchers. So do not decrease your credibility just for some extra work. All right. So we give a few references. Now these references could be similar, these results and references could be similar to your findings. Like if your findings are that intervention group is superior, these references could say that yes, the intervention group is superior. But also these references can also say that the intervention group is not superior. It's entirely possible. It's not important that you only give references which are in favor of your results. I couldn't find any which supported the control group, or I would have definitely added them. All right, once you're done with that, then you mention why. Why is this outcome so significantly associated with the intervention group? give me the reason for it. So here I've given the reason. One of the main causes of graft patency is the presence of nitric oxide synthase in the endothelium, which has been found to be preserved in the NT technique, resulting in increased patency of the graft. See, now that's the important thing. You were mentioning the reason for it. We can thus conclude that NT is in fact the better option if increased graft patency, decreased graft failure, and occlusion is the primary objective of the surgical treatment. See, now that's how you end the paragraph. You do this one by one for all of the outcomes. You elaborate all of the outcomes just like this, in the same way, in the same pattern. Okay, let's say that you included references, some of them were supporting your intervention group, some of them were not supporting your intervention group. What will you write in the last sentence? You will write in the last sentence, we can thus conclude that NT is in fact the better option considering our results. However, some studies may have found it to be comparable with the control group, but the findings of these studies did not have any effect on the pool synthesis. Okay, you can write something like that, but do mention it. Mention everything properly. Don't miss out on anything. That's how you do it for each and every outcome. Once you are done with that, we come towards the strengths and limitations section. Now, the strengths and limitations section is also very important. Some people write it with the discussion section without, giving a separate heading, but I'd say that it's better to give it a separate heading because that makes your text more organized and everything. So, all right, what's the strengths and limitations section about? It's basically about you mentioning the pros and cons of your meta-analysis. What is something that is good about your meta-analysis? What is something that is not really good about your meta-analysis? What are your limitations? What are your possible, gray points? Okay. So how do you find your strengths? Your strengths usually lie in your, your methodology. Let's say that you did drop assessment and all of your studies or most of your study had low risk of bias. You can mention that as a strength. Let's say that you carried out grade assessment. That's a strength because you are determining the certainty of your findings. It's a plus point. It's not something necessary, but you have done it. Now, that's something that adds to your paper. Okay, let's say that you have assessed publication bias. Now, that's also a strength. You are necessarily, removing the risk of publication bias affecting your results. You have cleared that. Now, that's also a strength. All right. So, how do we write about the strengths? This meta-analysis is a valuable contribution towards the understanding of comparative efficacy of no-touch and conventional vein harvesting technique in terms of short and long-term outcomes. So, one strength that we have mentioned here is short and long-term outcomes. Outcomes that, and because a longer follow-up period in your study is a strength because some adverse events, some negative effects become, they express themselves in a longer period of time. So if you only consider short-term outcomes, that means that you are not assessing the long-term outcomes. And in that way, your judgment could be biased in some way. Like maybe in the long term, the intervention group which you find to be superior expresses some outcomes in the patients which are not desirable, but you have not assessed those. So, one strength over here was that we assess both short and long term outcomes. Other than that, Grade Pro assessment has been performed to validate the certainty of evidence. Furthermore, most of the outcomes have a 0% heterogeneity, pointing towards the quality of our findings. However, okay, now up till here were the strengths of our meta analysis. From here, we start with the limitations. Now, what can you mention in the limitations? You can mention if your studies have a high heterogeneity. Also, if after Robb assessment or Newcastle Ottawa scale, you find a higher risk of bias. Now, that's also a limitation. If your studies were conducted in different geographical regions, that's also a limitation. Okay, so let's read this one. However, there are a few slight deficiencies that require to be highlighted here. The heterogeneity for revascularization outcome was moderate, potentially affecting the result. However, since the heterogeneity did not cross the threshold of 50%, there is only a minimal chance of it affecting the results. While synthesizing the results, we noticed that several of the included results studies showed concerns in different areas of methodological quality. All studies weren't free from bias, and one, HO 2021, stood out with a high risk overall. Common issues involved unclear randomization, inconsistencies in how the intended interventions were applied, and potential reporting bias. So here we've mentioned those domains of Robb assessment in which common issues arise. These weaknesses raise questions about the reliability of the data and the strengths of the conclusions we can draw. Although our findings provide useful insights, they should be interpreted with care, keeping these limitations in mind. See, if you have limitations, if your heterogeneity for some outcomes is high, if your Robb assessment shows high risk of bias in some studies, you must always mention that your results should be interpreted with caution. Okay? More rigorously designed trials would help clarify the true effect more confidently. However, despite these results, the quality of evidence presented by this meta analysis seems to be robust. Okay. Now let's talk about future implications. What do you write about in the future implication section? In the future implication section, you mention um you mention the reasons for sorry what could be the possible outcomes and benefits of your results in future in clinical decision making and everything. That depends, that varies from every study, from meta-analysis to meta-analysis, because your topic might be different than this topic. We have a huge range of topics. Someone could be doing a cardio related topic, someone could be doing a neuro related topic. It's different, but you must include the future implication section. That's something fixed. Okay, let's read this one. This meta-analysis sheds light on both the advantages and challenges associated with no-touch compared to conventional treatment. The findings suggest that NT significantly reduces the risk of graft failure and occlusion, which could have meaningful implications for long-term patient outcomes. However, the increased risk of leg infections raises concerns that warrant further investigation into patient selection and post-op management strategies. To strengthen these findings, future research should prioritize well-designed randomized controlled trials with standardized protocols. Long-term studies focusing on patient-centered outcomes such as functional recovery, quality of life, and healthcare costs are essential to determine NT's broader clinical impact. The absence of significant differences in secondary outcomes like revascularization, overall mortality, and myocardial infarction suggests that while NT improves graft patency, its influence on broader cardiovascular endpoints remains uncertain. Future investigations should explore whether specific patient characteristics, surgical techniques, or perioperative management strategies influence NT's effectiveness. Moreover, the increased risk of leg infections underscores the need for improved preventive strategies such as defined perioperative antibiotic protocols and enhanced wound care. Understanding the underlying mechanisms behind this complication could help develop targeted interventions that maximize anti's benefits while minimizing risks. Given the variability in anti's adoption worldwide, collaborative efforts, including multi-center trials and real-world registry analysis, could help refine clinical guidelines and optimize treatment approaches. See, now that's the future implications section. What did we discuss here? We discussed the possible implications of our findings on clinical decision making, about the outcomes which were superior as well, about the outcomes which were comparable as well. Let's see if the recording is on. Okay. Not this one. This one. That's what your future implication section should be about, and it should be tailored specifically to your meta-analysis. Look at the treatment landscape relevant to your population, and on the basis of that, write your future implications section. Okay, let's come towards the conclusion. Now, your conclusion is obviously, it's a very obvious thing. It's like 3 or 4 lines discussing your results in detail. No, sorry, not in detail. A summary of your results, a very short summary. Okay, so let's read this one. This meta-analysis demonstrates that the NT group had a significantly lower risk of graft failure and graft occlusion compared to the conventional treatment group with low heterogeneity among studies. However, NT was associated with a significantly higher incidence of leg infections. No significant differences were observed between the groups in terms of revascularization, all-cause mortality, or myocardial infarction. These findings suggest that while NT may improve graft patency, the increased risk of leg infections should be carefully considered in clinical decision making. Further research is warranted to optimize patient selection and perioperative treatment strategies. That's it. Okay. Now let's revise again. Discussion. First paragraph should be started with an intro. Then discuss your meta-analysis. Which outcomes are you considering? Then discuss the results of your meta-analysis. Which outcome was superior, which was comparable. Then, if you have any previous meta-analysis on your topic, compare their findings with yours. Then, we should discuss each outcome in detail. How? First of all, you mention what was the result for that outcome according to your meta-analysis. Then you discuss what are the possible causes for the development of that specific outcome. Then you discuss previous literature. Compare your findings with previous literature. Then you discuss possible reasons for your results. Why did you get this result in light of previous literature? Then in the end, you conclude briefly why is this outcome superior and are our results robust? Should we believe them? Is the evidence provided by us enough? Okay. So that's how we discuss each and every outcome. Then we have strengths and limitations, in which you first mention the strengths of your meta-analysis, which are usually based on your methodology, and the limitations are also usually based on your methodology, but you may also have geographical limitations, like the studies are set in different geographical locations. Some of your limitations may be that you um, in the baseline characteristics, your ratio of male participants was more than female participants, or ratio of older participants was more than younger participants, or vice versa. So different limitations, you can discuss them. The future implications section should be tailored specifically to your meta-analysis, and it should discuss It should discuss your findings in light of current clinical guidelines relevant to your population. Then the conclusion is a very brief summary of your findings. That's it.